Okay, perfect. So welcome everyone and thank you for joining us. We will be starting again promoting counselor multicultural and social justice competencies with Afro-Latinx immigrants.
Welcome, everyone. So glad you could be here with us today. We want to start by acknowledging where we are residing. We know we recently celebrated Indigenous Peoples Day, and we wanted to start by sharing with you acknowledgement of our ancestors. So I am Dr. Susan Franco, and I'm originally from Colombia, and my ancestors are from the Guahibo tribe in the Plains region of Colombia.
And I will be introducing my colleague who will be joining us towards the end, Dr. Dipre. She is from Dominican Republic and her ancestry is from Taino Arawak. And I am Dr. Diana Gallardo of Mexican descent and ancestry of Purepecha. Just briefly, if you would like to in the chat, if you know your ancestry and you would like to put it in the chat and share with us, you're more than happy to do so. I cannot see the chat, but hopefully you're all able to share with one another. So for today's agenda, we will do the following. I will be going over objectives. Then we will discuss some of the key points and introduction of the Latinx population. Following, we will discuss some of the experiences of Afro-Latinx immigrants. And then we will have some brief participation followed by the introduction of the cultural formulation interview. And then we provided a case study that we will share with you all and provide some application components to it. And towards the end, we will have Q&A. So the objectives include learning 3 challenges Afro-Latinx immigrants in the United States experience because of their multiple marginalized identities. The second one is to learn at least 2 strategies to integrate the cultural formulation interview when working with Afro-Latinx immigrants in the US. And then the third one is to learn at least 1 strategy for advocating on behalf of Afro-Latinx immigrants in the United States. So before we jump into discussing Afro-Latinx population, we thought it was important to discuss some quick facts on Latinx population in the US. So the United States Latinx population makes up 18.5% US population, making it the largest minoritized ethnic and racial group in the United States. This means that there are 62.1 million Latinx in the US. When breaking down the Latinx population's presence in terms of country of origin, we can see these here, and we kind of put them in an order of biggest presence to lowest. So here you can see Mexico, Puerto Rico, Cuba, El Salvador, followed by Dominican Republic, Guatemala, Colombia, and Honduras. When breaking down the Latinx population presence, we can see these, like I said, here in the order that we have them. We also wanted to share a little bit about the skin color, as in the United States, darker skinned Latinx immigrants are more likely to experience discrimination from other Latinx more than US born Latinx folks. So here we can start to see that though there is the largest population, the experiences may vary, right? And when thinking about the variations, we wanted to discuss how this would look within a counseling room. When thinking about mental health in this country, it has been viewed through a Eurocentric or Western lens for centuries, right? And in doing this, it has also ignored many of the origins of how mental health has been addressed through traditional ways of healing within communities. And in ignoring these traditional ways of healing, clinicians may not include a full picture or pathologize Latinx clients in an effort of having them fit some of the systems within the DSM or fit some of the diagnoses. Oftentimes, when within the Latinx culture is used as a proxy of race, meaning that culture has may be used as a way to describe a group of Latinx. And in doing so, it erases the racialized part of seeing Latinx as racialized human beings. For example, being Afro-Latinx or Asian and Latinx, where you can see Latinx clients both as cultural and racialized human beings. When Latinx clients attend counseling, clinicians may only focus on the ethnic and language and immigration related factors, for example, thinking about documentations versus undocumented status, right? And in doing so, they may not be seeing the differences, such as how Latinx immigrated the US, right? So for example, did they cross the border versus were they able to acquire the documentation required to fly into the country? Did they fear for their life as they were immigrating by foot versus maybe having fake documentation and flying and still having that fear, right? So we start to see some of those differences there. Clients may not identify racially, but rather based on country of origin. And in doing so, they may be erasing their racial identity, which is vital to working with Afro-Latinx clients. So an example of this could be an Afro-Latinx client who may be experiencing issues related to discrimination as they're commuting to work, right? And they may be experiencing some verbal things being said at them or something like that for being Black. They may share this with the client, with the clinician or the counselor, and they may not understand why this may be happening to them. And they may share with you or with the counselor that they don't understand why this is happening as they are not Black, but rather Dominican. So having that understanding as within the counseling aspect of it. So jumping a little bit, as you can see, we're building from the previous example, but jumping into the Afro-Latinx population, there is limited attention to this population, regardless of, despite the growing numbers. Black and darker skin Latinx may experience higher levels of psychosocial stressors, which can erode mental and physical health in addition to health behaviors. Additionally, Black and darker skinned Latinx have been found to have worsened mental health and physical health outcomes more than their white and lighter Latinx comparison. So when we start to see these intersecting identities, we can see that there are levels to Afro-Latinx immigrants within the U.S. So we wanted to talk more about then the immigration status of building into this, right? So immigration status has important implications for addressing mental health needs for Afro-Latinx immigrants. The literature tells us that immigration status impacts mental health differently, as researchers have found that based on the years of residence in the US, the relevance of immigration status on the mental health and the physical health needs of the immigrant may change. So for example, the longer an immigrant has resided in the country, the more that their cultural factors will deplete, and the less of these resources will protect them from the inherent disadvantage of being immigrant. This has been referred to as the immigrant paradox, where immigrants usually experience similar or better health outcomes than native-born populations, despite the socioeconomic disadvantages and barriers to service use. These outcomes are thought to be because of the cultural elements that buffer some of these disadvantages. Another important consideration for providing culturally responsive treatment to Afro-Latinx immigrants is the recognition of acculturation and further acculturative stress. Acculturation has been defined as a phenomenon that occurs when different cultural groups come into continuous contact, which results in subsequent changes in the original cultural pattern of either or both groups. While acculturative stress, on the other hand, emphasizes the psychological process involved in the acculturative process. In other words, so acculturative stress is the individual psychological experience of acculturation process, which, depending on the individual's resources, leads to the labeling of the experiences as stress. I like to think of it as acculturation as a big picture of groups and individuals within this group. So thinking about family or family members, for instance, and then for acculturative stress as more of a personalized experience of the individual, something that is unique to that specific client or an individual. This is particularly because of the resilience of the clients resources that leads to the labeling of the experiences of coming to contact with a different cultural group as stress. As stated previously, the type of immigration experience plays a significant role on the experiences and mental health of clients, as well as the day-to-day stressors, the feelings of hopelessness, and they are added to the anti-immigrant rhetoric here in the US. So I know that I have been talking a lot at you all for a bit. So I want to take a minute or so to share a prompt for you to kind of reflect. Feel free to, again, in the chat or just for you to hold on to and reflect on some of these questions. So what are your thoughts, beliefs, and feelings related to people who are immigrants? The following question is, what are your thoughts, beliefs, and feelings about immigrants who have different ethnic and racial identities than me? And what are my thoughts, beliefs, and feelings about immigrants who have similar ethnic and racial ethnic identities than me? Okay, so I hope that you're able to reflect on them, and if you are able to write them or discuss at the end, we'll go back to these as well. So now we're going to move to the cultural formulation interview, and Dr. Franco, I am.
Thank you, Dr. Gallardo. Thank you, everyone, for hanging in there with us as we continue. We're moving now to the CFI, as I'm going to refer to it, for the cultural formulation interview. And I'm curious to know, and maybe you could put this in the chat as well, how many people are familiar with the cultural formulation interview? Is this something that you've heard of before? Is this a new tool to you? So if you could take a minute and let us know. And as you're doing that, I'll share with you that this actually became part of the DSM-5 in 2013 when the DSM-5 came out. It was, so for some people, this is a couple people are saying this is new to you. It was a tool that was created by a group back in the previous DSM-4R, for those of you who might have been around during that time. They were working on this at the time, and they finalized the interview in 2013. However, particularly in counselor education, and both Dr. Gallardo and I are counselor educators, this is a tool that is not very widely known in counselor education. And I'm not sure the people who are answering that they weren't familiar with it or it's new to you if you're a counselor in counselor education or not, but we don't use it enough. So we believe that the CFI can be a really helpful tool for all populations, but particularly when thinking about Afro-Latinx populations. So we're going to share with you a bit more about what is the CFI and how you might be able to use it. And at the end, we're going to be able to, hopefully, if not in the chat, if we can't post it in the chat, we'll give it to the presenters, a copy of the CFI. So it's basically an intake of sorts. It's a semi-structured instrument, and it's really created to help clinicians, probably use the word counselor frequently because that's how I identify, to be able to conceptualize our clients in through a cultural lens. And the way they do that, the tool does this, is by asking questions that really open up the discussion to get the client's viewpoint. And it also looks at various intersecting systems of culture oppression, as well as support. So it's a very important instrument. It comes with 3 components. So the core interview is for lack of a better way of putting it, intake in which we, the counselor clinician, would be using to work with the client. But then there are 2 other components that you can also use. The informant interview enables the counselor to gain information from family members or other important people in the client's life to talk about how they view whatever the concern is. Obviously, of course, you would be getting a release of information and client permission before doing that interview, but it does go alongside with the core interview. And then there's a supplementary module that we'll look at in a second that gets even more specific about different aspects of what is happening with the client and why they are seeking counseling. So let's take a closer look. So the core interview, and this is probably the one that you would be using most frequently, is 16 open-ended questions. Research that we found indicates it takes about 20 minutes or so to get through the entire interview, dependent on how long people respond or the kind of conversation you engage in. But there are 4 domains, and all of them have the goal of getting information directly from the client. So the first domain is getting a sense of what is the client's cultural definition of the problem based on how they're viewing what's going on in their lives. It also gets the client's actual perceptions of the cause and the context of the problem, as well as support that they already have that they can use as strengths to working towards a resolution of the problem. It also gets at cultural factors that affect the current issue, but also asks them about past self-coping and help-seeking strategies that they've used. So that way you have a sense with the client about things that have been helpful to them in the past. And then it also elicits information about cultural factors that affect their current help-seeking behaviors. And this can also include limitations or barriers that they might be encountering to receiving help. The informant interview, again, is what you would use for family members or friends or important people or other providers in the client's life with their permission. And again, it's very similar to the core interview. However, it's getting the perspective of other people in the client's lives. So you can get a sense of how they are viewing different aspects of the problem. It has the same 4 domains as the core interview, and it addresses the same categories as the core interview. And then the last component of the CFI that you can also use is the supplementary modules. Now, this will take a longer time, and you could use this throughout the counseling process. So while the core interview is typically useful at the beginning of the counseling process as a supplement or replacement to a traditional intake, The supplementary models are often helpful to use as you continue your counseling process. And they're really meant to allow you as the counselor to get more of a comprehensive cultural assessment. And as you can see, there are 12 different categories, all the way from level of functioning, the social network, getting a sense of their relationship with the parents, and there's a special section for school-age children and adolescents, and then it goes on through specific information about immigrants and refugees. So there's many different categories that you could explore that will most likely become relevant as you continue to work with a client. It's important to share that some of the research about the CFI is indicating that one of the advantages of the CFI is that it builds trust. This should not be too surprising because we are getting a sense from the client's viewpoint as opposed to us indicating how we think the problems are happening. We're really letting the client know by collaborating with them using the CFI that we really want to hear from their perspective and that we actually trust their perspective and how they view how this problem that they're seeking help for has developed in their lives. So evidence from research indicates that clients find that the CFI helps them to feel trusting of the relationship with a counselor. So some of you may be aware of the counseling intervention broaching. And this is an intervention coined by Dr. Devines and colleagues back in the early 2000s or mid 2000s that talks about ways of addressing clients' identities specific to race and culture. And we view the CFI as a longer expanded version of broaching in many ways because you're getting at all sorts of aspects of a client's identity. So the other pieces of research that we found indicate that sometimes there could be barriers to using the CFI. Some of them include the clinicians using the CFI not having training and getting somewhat stuck on only focusing on racial or ethnic background, which of course we know is very important, but missing all sorts of other salient identities. And then some indicated that it was a bit challenging to determine the structure of the CFI, since it is semi-structured, but it could go on for a long time, as you can imagine, which we think is a good thing to getting to know your client, but it can be hard to categorize or quantify or score. So it's not meant to really be scored, but it's meant to gather a lot of information. We found a training that I hope will successfully be able to be posted in the chat. Here it is. And it is a training group outside in New York State. And it was originally created for people who are clinicians practicing in New York, but anyone can register for the training. It does cost, but it's lower cost, and it's about a 50-minute training that will walk you through how to use the different modules of the CFI if you're interested.
Thank you, Dr. Franco. So using everything that we have discussed thus far, we wanted to provide you with a case study that we will walk through together to help you kind of see it and visualize it and apply it to some extent, right? So Martin is a 33-year-old dark-skinned Afro-Latinx immigrant from Mexico who is seeking counseling for the first time for what he describes as an intense nervousness. Martin has noticed that he began experiencing muscle tension, excessive sweating, and increased agitation in the months following his relocation to the US. Martin relocated about 14 months ago due to his job. He works as an engineer for a well-known firm in the city. In the counseling intake session, Martin describes feeling incompetent at his job as others are often questioning his decisions. Martin reportedly never experiencing the current systems before and is confused and scared. Martin responds with hesitancy, although is willing to engage in the CFI questions.
I'll add, Dr. Gallardo, that one important piece of the CFI, which probably goes without saying, is to be very clear with clients that you are going to be using the cultural formulation interview, because as I mentioned previously, one of the barriers was clinicians feeling as though it got unwieldy, for lack of a better way to describe that. And what seemed to be helpful, according to the literature we found, is when clinicians were very clear in the consent process that they were going to be using this CFI and seeking clients' permission to engage in that process. So this is why we wanted to highlight in our composite case study that we have here that Martin was hesitant but willing to continue with the CFI questions as the counselor made clear that that's what they'd be using.
So we will be providing a counselor-client exchange to illustrate the application of the CFI in an abbreviated intake session with this particular client. Though we recognize that it is not the only way to interact or the way it played out, as we move to the Q&A portion of this session, we would love to hear your ideas about alternative ways in which you may see the CFI can be applied to the case of Martin. To begin the session, the counselor must first review the confidentiality limits, risk, and benefits of counseling the client, then explains that they will be asking questions from the CFI. In this case, Martin states, "I am feeling incompetent at my job as others are often questioning my decisions. I have never experienced the current symptoms before, and I'm confused and scared." Because the counselor wanted to have a better understanding, to better understand the cultural definition of the problem, they can ask something like, sometimes people have different ways of describing their problem to their family, friends, or others in the community. How would you describe your problem to them? From the core interview, to which Martin could respond by stating, "I would tell them that I thought I finally made it. I have a job. I am a full-time. I'm working full-time, and I earned enough to take care of myself and my family. But now strange things are happening with me. I get sweaty out of nowhere or for no reason. I feel sore in my body, and I cannot seem to calm down. I have never felt like this before." This gives the client a better idea about how the client is understanding his own presenting concerns.
And this might be a point where maybe a more westernized conceptualization of concerns would encourage the counselor clinician to jump in with going through a checklist and moving to a DSM-5 diagnosis or starting to ask more about symptoms. However, the CFI actually veers away from that and moves on to getting more information about the cultural perceptions of the cause, context, and support that Martin may have. So the questions that you see listed for the counselor are questions directly taken from the CFI. And the next question is, what do you think, the counselor is asking Martin, are causes of the problem? And Martin is able to describe that they miss their friends and other things, but my family is here, so I don't understand why this is all happening to me. Like I said, I was finally able to get the engineering position and it pays really well. I work with a lot of people who are really skilled engineers, so I'm not sure what's going on. So here the counselor has an option, right? There's some options and different ways they could go. We recognize that. But in this instance, the counselor moves to finding out more about what's happening at work. So say more about your new job. It sounds like it's something you worked hard to achieve. And Martin responds with, like I said, I really like the new position and I try really hard to do my best. I show up early and stay late. I wear a suit and tie every day, even though other people do not. I guess people are trying to help me because they ask me a lot of questions about what I'm doing and if I understand things and when I will be done.
And now Dr. Dipre has joined us. Welcome.
Hello, everyone. Can you all hear me? Okay, great. So I am going to finish this part of the slide and want to kind of address just a little bit that this slide here, we wanted to leave it a little open-ended just to showcase how the counselor can choose to go in two different directions. So if the counselor, makes note of the last part that was showcased a little bit, they could ask about supports that Martin has available. So the counselor could ask, are there any kinds of support that make the sudden sweatiness, body soreness, or trouble calming down better, such as support from family, friends, or others. But the counselor can also seek to really address larger systems here and really wanting to think about what parts of Martin's backgrounds may be coming to play here as he is navigating this issue and seeking counseling for. So for example, the counselor may choose to ask, sometimes aspects of people's backgrounds or identities can make their problem better or worse. By background or identity, I mean, for example, the communities you belong to, the languages you speak, where you or your family are from, your race or ethnic background, gender, sexual orientation, faith or religion, and really giving Martin a clear understanding of what we are asking about when it comes to background. And also, asking in addition, what are the most important aspects of your background or identity to really avoid making any assumptions as to how Martin is being affected by different systems of oppression linked to these different social identities. And really, we wanted to highlight here that the counselor can go in different directions based on their sense of what Martin needs in this moment. And as I'm sure my colleagues kind of mentioned, there's no right way of going about this, but this is just one way in which we see the CFI playing out with this client. And in addition, not included in the slides, but the counselor can also seek to make use of the supplemental modules. And one specific module that could be helpful with the second kind of set of questions is the module 6 that is really specific to cultural identity and how that is interpreted by the client to be salient or not. Next, we'll talk a little bit about assessing cultural factors affecting self-coping and past help seeking. So here the focus is really to understand how Martin is managing his symptoms and really how he could have previously sought help and what were the things that were helpful. So the counselor can really be informed as to what strategies to use moving forward. So here the exchange goes as follows. The counselor could say, what have you done to cope with those things that happen to your body? Martin responds, when the feelings happen at work, I go to the bathroom and splash cold water on my face. I might also get a glass of water and sometimes go outside to get fresh air. Once, when it was really bad, I called my sister. I'm going to pause here for a second to note how Martin really is giving the counselor information that can be really helpful, strategies that have worked or have not worked so well, and the resources, again, the support that Martin has used to cope with his symptoms. Next, the counselor could respond, Martin, you shared that this is the first time you experienced this problem. However, I wondered in the past, what kind of help did you find useful for other kinds of problems you may have experienced? And Martin to respond, usually I seek help from my siblings first, much like now, and then my parents. But now I do not want to worry my parents because I have not told them what is happening. I also find some comfort in prayer at Mass. Again, here we see that Martin is providing a great deal of information that the counselor can make use of and elaborate on using the different supplemental modules of the CFI to really formulate a great understanding of him and how to best support him. And then the last important piece of the CFI is really understanding what factors are affecting current help seeking and how can the counselor attend to the relationship here that they need to develop with Martin. So we can think about, the counselor asking what kinds of help do you think will be most useful to you at this time for sudden sweatiness or in uncalm feelings, as those are the things he is complaining about and bringing into session. Martin could respond, I think directions on how to get it to stop would be really important because I do not want people at work to notice. As it is, they asked me a lot of questions about what I'm doing in the out of nowhere sweating and discomfort makes it worse. The counselor can then choose to ask, sometimes when counselors and clients misunderstand each other because they come from different backgrounds or have different expectations. How have you been concerned about this? And is there anything we can do to provide you with the care you need? And here, the intention of the counselor asking this is noting that Martin has already given some information about, not feeling like accepted at work and really wanting to prevent that from being the case here in the counseling space. And the counselor can go back again and really reiterate that, but it was important for the counselor to really make sure that they attended to that relationship because it's such a significant piece of Martin's concern, wanting to feel accepted and really not have these concerns in this relationship as well as he has at work. And then Martin will respond with, well, you're not a man and you're not from Mexico, so I am not sure if you will understand. Also, English is something I'm pretty good at, but still working on it. Do you speak Spanish in case I have to say things in Spanish? And here, again, we're not making the assumption that we know as a counselor, what Martin's, prioritizing in terms of the relationship, or really, the counselor can choose here to share their competency in Spanish, if they speak Spanish or not, and how can they really attend to this and comfort Martin's concern related to, am I going to be understood again? This is part of something that's translating from also his concerns from work and really not fitting in and struggling to really be seen in these ways without having the symptoms that he's talking about. Am I missing anything? Does anyone want to add anything? Okay.